Namaste viewers, welcome to our today's discussion. On the occasion of World No Tobacco Day, our today's discussion is on harmful effects of tobacco use. And for our discussion, we have with us Dr. Arsheed Hussain Hakeem, Senior Consultant, Head and Neck Surgical Oncologist at Apollo Hospitals, Jubilee Hills, Hyderabad. Welcome, Doctor. Welcome to our session. Starting with our first question. Doctor, can you explain to us what oral cancers are?
Thanks for having me here. Oral cancers are cancers arising in the oral cavity. What we mean by oral cavity is the mouth. If you open your mouth, you will see there's a pink lining that's covering right from the lips to the cheek, that's we call buccal mucosa, to the lower alveolus, upper and lower gingivobuccal sulcuses, floor of mouth and tongue inferiorly, and if you see up, there will be hard palate. This is lined by a mucosa which is pink colored, which is full of luster, and this is healthy. So this is the oral cavity. And if any cancer, which is the multiplication of any bad cell in the oral cavity, that we call oral cancers. These mucosal lining cells, they change their character, they proliferate, and they not only proliferate, they cause invasion of the surrounding structures like the muscles, bones, or fibrous tissues, and these are called oral cancers. And oral cancers in 90% of the cases are associated with the tobacco use. Tobacco use in any form, either chewing tobacco or smoking or using it in the snuff form or applying paste to the mouth or gums. And also not only tobacco, also the use of areca nut or what we call betel nut, or in simple language we call sparry, or alcohol intake.
How will a person come to know that he or she is developing oral cancer?
Now I told you what is oral cavity. So if you see this, if you open it in front of the mirror, you will see it is lined by a pink healthy mucosa. But what happens in those cases which are abusing tobacco or using betel nut or what we call sparry, what happens, it changes its color. It becomes lusterless, it gets fibrosed, it gets thickened, and that condition we call oral submucous fibrosis. And that is a premalignant condition in itself, and the cancers can develop in that. Now they may also have some patch, some may have a white patch or what we call leukoplakia, or some may develop a red patch, what we call erythroplakia, or some may have different combinations of these. Also, they may have a frank ulcer, which is the breach in the oral mucosa, lining of the oral cavity, and any breach or ulcer which is not healing in 3 weeks should be shown to a specialist and a biopsy done. Or they may also present with a frank growth in the oral cavity anywhere, the buccal mucosa, tongue, or alveolus. So, pain initially is not the feature of oral cancers. It's only if one keeps the oral cancer and it advances, and then it causes erosion of the surrounding structures like periosteum of the bone or the surrounding structures, nervous tissue, then only pain develops. Once pain develops in the oral cancer, it means that cancer has really advanced. Or it may also develop as a swelling in the cheek in case of advanced stage, or there can be a frank ulceration in the cheek and a cavitating ulcer also formation. Sometimes those patients also may present as loosening of the teeth, and if one carefully examines those teeth, surrounding socket of teeth, you will find a growth around those teeth. They can also present as a loosening of teeth, or some may also present as a swelling in the neck. If there is a swelling in the neck in presence of an oral cancer, that means that the cancer has metastasized, that is thrown cells to the lymph nodes, that there is a lymph node metastasis. These are how a patient can come to know whether he or she is developing an oral cancer or any premalignant lesion in the oral cavity.
How does tobacco use causes oral cancer?
See, I am head and neck cancer, and all the oral cancers I treat, around 90-95% of them are associated with the intake of tobacco. Tobacco in any form, whether they may be chewing or they may be using and the smoke or smokeless tobacco. Now we know that there are thousands of chemicals in the tobacco or areca nut or betel nut, but we know there are certain 70 carcinogenic chemicals, which are cancer causing agents that are present in the tobacco, which result in damage to the DNA of the cells. And if this damage occurs, when it's not it becomes irreparable, that the body usually tries to manage these damages by repair. But if it becomes irreparable, there will be a clone of cells that will grow and that will proliferate and invade the surrounding structures, resulting in the cancer formation.
Doctor, some says that I chew only little bit or smoke only few cigarettes a day. Does that also leads to cancer?
Uh, Scientifically speaking, there is nothing like that. I chew only a little bit of tobacco or I smoke only 1 or 2 cigarettes a day. There's nothing to suggest that a little amount will not cause cancer. But it's true that more the consumption of tobacco, more the chances of cancer. Means a person who is consuming more tobacco, they have more chances of cancer. But sometimes there are a lot of people ask us questions. My friend is chewing more than me, or he has been chewing from more time than me, or he's smoking more cigarettes than me. Why I did develop cancer and he did not? A scientific explanation of such a occurrence is that the individual susceptibility, which means one person's cells may not bear the damage that's caused by the tobacco. So even if he is taking a little bit or chewing a little bit or smoking only 1 cigarette per day, it may be harmful for him, and that may result in cancer in him more than the person who has smoked for more time or is smoking more cigarettes or chewing more tobacco.
What is oral cancer screening?
Screening per se means that any test, any examination, any tool or which is used to pick up the cancer in the early forms, that's in the precancerous stage or in an early, once it is in stage 1 disease. So the main aim of the screening is to pick up these cancers when they have not formed. So that has been shown scientifically to reduce the mortality or the death rate because of the cancers, because we are picking them early, we are treating them early, or we are taking precautionary measures to not let it grow into that region that it causes morbidity and death. Now, for oral cancers, every cancer has a tool or an examination or a test that can be used as a screening. In the oral cavity, the best form of screening is an examination by a clinical specialist, a specialist head and neck surgeon with a good torch, with a good light. That is best thing, and it has been shown that a good examination every year for a patients and for approximately 3 years for people who are chewing tobacco or smoking or drinking alcohol, it has shown that we were able to pick up these cancers in the early stage and benefit these patients, and their death rates are decreasing. Now, there are other ways of screening in oral cancers. There are some ultraviolet lights which we can put in the oral cavity, and that can show us the areas which are likely to have cancer. Or there are some dyes what we can use and put in the oral cavity, and that can again tell us which areas are more susceptible to cancer formation. And there is also scrape cytology, wherein we take some cells from the oral cavity and put them on the slide, and the pathologist examines them, and that is known as scrape cytology. But all these 4 things, best thing is a good examination by a clinical specialist under a good light. That picks up majority of the cancers in their stages, which are either in their pre-malignant form or early stages, and the results of treating such a cancer are excellent.
What are the importance of diagnosis oral cancer early?
The significance or importance of diagnosing an oral cancer early is simple. Now, we have 4 stages of cancer: stage 1, 2, 3, 4. 1 and 2 we call early stages, 3 and 4 we call late stages. In early stages, if we pick up a cancer in an early stage, in stage 1 or stage 2, we may treat them with a single modality of treatment. And in most of the cases, it is surgery. Or some cases we may choose radiation as an initial modality. So what happens if we pick up the cancer early in stage 1 and stage 2, we only use one modality. And what happens with that? Because these cancers, oral cavity has 2 important functions. One is swallowing, and there is speech, and third one is cosmesis. So if we pick up cancer in stage 1 and stage 2, the cosmesis is not that much affected. The swallowing is also a safe swallow is also can be done after surgeries of the T1 and T2. Their swallowing does not get affected much. While as if we pick the cancer in the stage 3 and stage 4, they need multimodality therapy, which is one they need to go as surgery, which is bigger surgery. They need to go under radiation and as an adjuvant treatment, and also some cases may be treated as an with the chemotherapy also. So one, if you use a single modality of treatment, the financial burden on the patient is very less. He gets cured. In stage 1, if we do surgery, the chances of cure are of about 90% and above. If we do it in stage 2, the chances of cure are around 80% and above. If we do it in stage 3, the chances of cure are around 60% and above. And if we put the cases in stage 4, the chances of cure drastically drop to 40% and above. So not only in stage 1 and stage 2 we can have a better cosmesis, we can have better speech function, we can have better swallowing function. Also the amount of burden, financial burden on them is less. And you can imagine that three modalities, using three modalities. First they have to undergo a surgery, which is not a small, which is a big surgery. That financial burden, added to that will be the radiation therapy, added to that will be chemotherapy. So it has both cosmetic, functional and financial implications on the patient.
How do you diagnose oral cancers?
So any case which is a tobacco chewer or uses smoking and develops all these pre-mentioned, I have said, either a red patch or a white patch or a frank ulcer or a growth, they should immediately consult a head and neck surgeon. The surgeon will just take a small piece of tissue from that area and that send it to the pathology lab. Within 1 day, report will come that whether the patient has cancer or not. Now, there are other methods like scrape cytology, but that has not achieved the significance as we have for the biopsy. And one important thing is that there is a common myth that people say if we take a biopsy from the cancer, that cancer will spread. No, it's not like that. There is no scientific proof. Only that cancer is bad and it is growing. Once we touch it, nothing is going to happen. It's only the basic nature, biology of the cancer. It progresses, and it progresses at the rate it is determined to. So it will involve. These are all invasive cancers. So biopsy does not change the biology of the cancer. It just in fact benefits the patients by giving us a diagnosis. And also CT, any imaging, whether it is CT scan, whether it is MRI or PET scan, it's not going to diagnose the cancer. It is just going to tell you where the invasion is. That is, it's going to tell you the extent of disease and help you in staging better the cancer. And it also provides a roadmap for the surgeon what surgery he has to do before sending that patient to the operation theatre.
How do you treat oral cancer?
Now, 90% of the cases of oral cancer which present to us have to undergo surgery because the best modality of treatment, whether it's stage 1, stage 2, stage 3 and stage 4. Now only 10% which may be we may decide against the surgery, they may have to need either a radiation and chemotherapy in combination or only chemotherapy depending on the palliative mode of the, like if you have up to stage 4A which are operable, they need first surgery followed by adjuvant treatment in case of stage 3 and stage 4. Adjuvant treatment in those cases will be radiation or radiation in combination with the chemotherapy depending on different factors which we can best judge on the final pathology report of the cancer after surgery. And some people, if they have already metastasized to the different parts like lungs or this, they can be treated with palliative chemotherapy or immunotherapy. These are the modalities we use for treating oral cancers.
Doctor, do you have any message for our viewers?
Yes, definitely. These cancers, they are preventable. This is because of the tobacco or alcohol or spari which we are taking that is causing this cancer. So for the younger generations who have not started yet, don't come under peer pressure, don't start any form of tobacco or alcohol or spari use because there is nothing ahead, there is just destruction ahead. For those who have not started, this was for those who have not started yet taking these things. But those young people who have already started, who are already habituated to such, they should they should stop it immediately. And if they are not able to stop it immediately, they should consult some social workers, or there are some agencies which help them in cessation of, there are some tobacco cessation programs. They should consult people from those societies, and they will help them in stopping this menace. And those people who have already taken tobacco and who have already developed these pre-malignant or malignant regions, they should quickly, immediately consult the head and neck specialist, and he will treat them appropriately.
Thank you, Doctor. Coming towards our last question, Doctor, could you please tell our audience about the facilities provided at Apollo Hospitals, Jubilee Hills, Hyderabad?
Apollo Hospital Jubilee Hills is equipped with dealing with such cancers. We have right from the beginning, once the patient comes to us for the diagnostic, very good labs, pathology labs, very state-of-art imaging. We have PET scan, CT scan, MRI scan, whichever is needed for the, just staging these cancers. Then we have good surgeons available. We have good equipment in our theaters. We have good microscopes. We have good state-of-art reconstruction, which is a free flap. We have good surgeons available who can reconstruct them even after big surgeries, major resections. We can rehabilitate them with surgery by rebuilding their face and mandible bones with a microvascular surgery. Apart from that, for adjuvant treatment, we have state-of-art radiation therapy. We have IMRTs, we have tomotherapies, which are the best in India, which are available so that we can manage these cancer patients adequately.
Dear viewers, we have come to the end of our session and hope we have covered all aspects. If you still have more doubts, you can book an appointment with Dr. Arsheed Hussain Hakeem and clarify your doubts. Thank you, Doctor, for educating our audience in today's live session. Thank you for joining us. Stay tuned for more such educative live sessions. Namaste.
Thank you.